Excellent, thank you very much. Okay, yes, so let's get started. My name is Chris Elkin. A slight change of pace, hopefully this afternoon. Oops, let's go back to the first slide. I work for a company called Piota. We are a leading provider of healthcare apps into the NHS in Scotland, Wales, into England. Me personally, I've been in the industry for about 20 odd years. I've been creating lots of different content for different organisations. I spent 10 years working for the NHS, creating online learning, lots of mandatory training, learning management systems. I won an award for a passport app that I created, again around mandatory training. So I've been around for quite a long while. And a part of my experience was managing websites and intranet. So quite a good understanding of how things kind of work. I've got a particular interest in making things easy for people. I think as a technology specialist, if you will, I think it's our role to make our frontline staff, I keep saying ours, I still think I work for the NHS, but our frontline colleagues make their lives as easy as possible. So, provide all the information they need, make it quick and easy to find, allow them to focus on their roles, what they signed up for, which is, looking after people and not searching around internets and intranets looking for information. So, I think it's part of our responsibility, again, to make it as easy as possible for our colleagues to find information. And I've also got this other sort of mantra, don't make me think. If people don't have to think about a particular task or, searching around for information, they're more likely to do it. The minute you've got to kind of think about it and give it some thought, you'll probably get, you'll probably answer a call or going to speak to a colleague. So, the more easier we can make it for people, the more likely people are to use some of these digital systems. As I mentioned, can't go forward. As I mentioned, we work with about 80, 90 clients now. We're working with, I think, 7 out of the 12 Scottish boards, working with NHS England and Improvement, working with Public Health Wales. We work with a whole raft of different trusts, different teams, right across the board. So we've got probably, I'll say, sort of 80, 90 apps out there. Our app platform is a platform that we can customize for our clients. So our apps always look a little bit like the same. There's a logo at the top, plus a grid, which are these are what we call our tiles. And this is essentially your menu system. There's lots of apps that we kind of get involved with for both for staff and for patients. So we've got apps here. This is a transition app for the youth service at Derby Hospitals. We've got one here for University Hospitals Birmingham, and this is all their paediatric guidelines and protocols aimed at clinical staff. Healthy weight apps, a whole raft of apps, all for different organisations. One of the big reasons that people come to us is that they've recognised that they need a different way of communicating with their audiences. And when I say audiences, that could be your colleagues, frontline staff, people within the team, people within the organisation. It could be your patients, families and carers, where they've tried to work with the internet and intranet with little success. And they want a more direct way of communicating and engaging with their audiences. So this is a really quick and easy way to do it, as I say. Having worked for the NHS for a few years, I wish I was aware of this app when I was working. It is super easy to use and configure. So different apps, different organisations, as I say, they all look sort of familiar, they all look the same. What we'll do is we'll get into a case study. So as I say, it's all about making our working lives slightly easier. I don't know if you can sort of, you can look at these images and kind of, reflect on those. But, we're finding more and more the feedback we're getting from organisations is that there's lots of information on the intranet, but people are just struggling to get onto a computer to actually access it. So, whether it's in a busy A&E department or, within a clinic or in some instances, and I'll show you examples later on of sort of frontline domestics and facility staff. They've just got no way of accessing a computer, during sort of work's time. There's a lot of information on there, a lot of support information on there, a lot of information around training and development and opportunities. And a lot of these staff are just kind of coming back and feeling a little bit excluded because they don't have time within the working day to be able to access the internet or access the internet pages. Where they really want to access it is when they've sat at home and they've released the pressure valve and they can go and look at the training opportunities or the job opportunities or the support networks that are available to them, which they can't do through the day. But at that point, they don't actually have access to these systems. So, using apps, and we're all using phones. I say we're all using them. I assume we're all using phones these days. Apps are right up there in terms of what people are doing on the phones, so it just makes sense to be able to extend your reach using an app to communicate with your audiences. This is an example of one of our apps used by the Dudley Group. This is created specifically for the emergency department team. The app itself, again, it follows the same structure as most of our apps. There's the logo at the top plus the tiles. On this particular app, you need to register first. So you need to put in your details. It's your nhs.net email address. Then when you've opened up the app, you can then go into the different areas. So first up is all of the policies, procedures, and standard operating procedures. They're all in there. They're all A to Z, and you can go and find them at any time. Again, part of the reason the consultant created this particular app is staff within the team. We're just having to queue up almost to try and get access to computers, to try and find sort of, basic information really. So being able to put it all onto their supercomputers, which lived in their pockets or in their tunics, it just made a lot of sense. It creates a lot more efficiency, and it creates a lot more time within the team for them to be able to focus on, the important things. So all of the policies and procedures are all within the app itself. All very easy to go and access, all of the different guidelines for the different areas available, and you can go in those and access those wherever you are, whenever you are. So it doesn't necessarily need to be in the hospital. You can access these outside of hospital, and he was sort of suggesting that some of the senior consultants will get calls from time to time from some of the junior staff asking questions about, whatever it might be. They can, whilst they're speaking on the phone, they can pull out the app, find the guidelines, and then give them the, the clearer instructions if they can require it. Lots of information that they've got things like the rota on there. Again, you need to normally be into the hospital to access the rota, but you can click this button. I can't show it, it's obviously their rota, but you can go and access the rota, and that's for sort of permanent staff and for rotating staff coming through it. Again, it just makes life easier for people to be able to plan their lives outside of work when they can just pull out their app and access some of the work-related documentation. We've got within the app itself, you can create forms, and if you've used Smart Survey or SurveyMonkey in the past, you're kind of familiar how these forms are put together. But these are using lots of different forms for different reasons. So annual leave request forms, again, you can do it on your phone, on the bus, on the way to work. They have a handover sheet, so there's no patient information within the handover sheet. It's more about what happened during the shift, how we reflected, what were the good points, bad points, so on and so forth. There's a little bit of workflow in there that gets submitted to the administration team once the AE consultants have filled these in, and they go and be stored elsewhere. So it's another great way of just using forms and surveys in different ways to be able to capture information, but using your phone, to access it. Not having to again queue up for a computer, or try and wait behind after your shift, or come early in shift trying to get hold of that computer, trying to get access to the computer. It's all done by your little computer in your pocket. They've got an extensive directory, and again, you can't access any of these numbers unless you've logged in with your nhs.net email address. But all of these numbers go straight through to consultants' mobiles. So quick and easy. Let's remove the obstacles. If I need to go and speak to somebody, I haven't got to start searching around and asking people for phone numbers. I can go into my app, put in my nhs.net email address, log in, and press one of these buttons and be speaking to the person I need to speak to. We're just making it so sort of fluent in terms of the process. More people can then sort of focus on the important things. They put the mandatory training on there, so lots of links to training, whether that be internal training, whether it be external training, whether it be ESR or e-learning for healthcare. Lots of links on there, lots of training videos on there, lots of quizzes on there. And again, people can come in, go into the training, complete some training, and do the majority of it on the phone. And this can be done anywhere, at any time. Obviously, links to different resources. So all of this content has been created by the lead consultant at the organisation. Again, you know, his motive for this is to make the lives of his colleagues easier, which ultimately, you know, makes his life easier, I guess. So he's creating all the different links. You know, removing that, I've got to think about it too much. I can pull out my phone, I can go to the app, and whatever the question I've got, or wherever I want to go, or, you know, whatever interest I've got, it's on the phone, and I can access it from wherever I am. Obviously, with it being a phone and a phone app, we can use push notifications and alerts. So this is a great way for the team to update everybody of anything that's happening. So, you know, examples here, they've got up and down time for Wi-Fi's, blood gas results, you know, whatever might be happening within that team. The administrator can put a push notification, put an alert out. I think we looked at numbers recently, and we're looking at our phones, you know, 2 to 3 hours a day, a little glance here, a little glance there. You know, so if you can see a notification, it's going to come from the Works app. You know, you're going to pick it up, have a little look at it, and you're going to be updated almost kind of straight away. So, you know, a real good way of using alerts and push notifications to be able to keep people, you know, up to date. And that's one particular app. I'm going to fly through a couple just to kind of give you a range of the different things we're up to. Same principle. This is for the FM team or facilities management team at Derby Hospitals. Different audience. This is not for, you know, healthcare professionals, but this is for the facilities team, the domestics, their cleaners, the security team. And again, the sponsors of the project just felt that they didn't really have a really strong connection in terms of getting information out to these colleagues. They don't have access to the internet. They didn't have email addresses. You know, it was all through team leaders cascading information down. So for the FM team to be able to have an app to encourage their colleagues to download it onto their devices and start using it has been a real godsend for them. So same principle. They'll need to register first and put in their email address, so the device can, you know, is sure that you're a member of the support services. And then once you're in, they've got different sections providing, you know, their colleagues with all the information they need. So lots of, you know, good news stories, information about, well, this is a really good one. This one is a connection to actually the internet itself. So we worked with the networks team. The networks team allowed us our app to punch through their firewall, so their staff essentially can click on that link and get access to the trusted internet directly from the phone. So again, you know, we're not looking to reinvent the wheel in terms of content. So you know, some of the generic information that's available to them, the team there can just click on and access the internet directly from their handsets, from their telephones. Yeah, they've got this. So again, you know, connections to training. So this is their learning passport. So this is the, you know, a link to the system itself, so they can go and see, you know, what training they need to do, what you know, where they are in their mandatory training cycle. There's information online for different bits of training. So just providing everything again that audience needs. It's a bit of a one-stop shop. You know, I want to do some training, I want to book a holiday, you know, I want to see what benefits are available to me. They can kind of pick out the phone and get up to date really, really quickly. This one talks about staff benefits. So we found this a lot. Well, I think organisations and trusts have got really good health service discounts and benefits and various different things. All the information stored away on the internet, but people just aren't aware of it, you know, and are missing the opportunity. So again, you know, being able to put this front and centre, staff benefits, people can see what's available and what they can do. You know, it's great in terms of you know, well-being and supporting your colleagues. Well-being. So moving on to well-being again. You know, everything that's happened over the last couple of years. You know, just looking after people, ensuring that they've got the information they need, they've got the support they need, they're aware of different networks and you know, different support services that are available. Again, a lot of this information is on the internet, but they've got no access to it. So yeah, it's all being displayed and deployed through the app. Right, this is more links. So this is a link to ESR, so they can link to their you know, the ESR system, so they can get the pay slips and various other different bits and pieces. It's the same principle, just a different audience from a different organisation. This is the third one, specifically looking at staff engagement. So this one's for all staff at St Helen Knowsley, and exactly the same principle, providing all of their colleagues with information about the different support networks that are available, different benefits that are available to them. There's a section on technology, so it spells out what is Microsoft Teams and how do we access it, how do I access NHS.net from where I am, how do I access ESR. So again, just providing all of those links to all of those different resources. The colleagues at that particular organisation can pull out the phones at any time and get that information, so they can access those systems quick and easy, and they're not having to think about it too much. Someone's done thinking for them and just laid it out and put it onto an app, which they can access, whenever they want, whenever they've got a minute to think about it. Again, information about benefits, different alerts, again, just keeping people abreast of everything that's happening within the organisation. This one is, and I really like this idea. This is the pulse check. So again, it's just a simple form. Again, it's basically the tool with our system looks very much like Smart Survey or SurveyMonkey, so really easy to use. But they were just using this at the start of the pandemic just to get a feel for how their colleagues were feeling. Did they have the right training? What was the leadership like at the time? Did they have sufficient PPE? Just trying to get a quick pulse check of how people were feeling. The idea being that they could do 2 or 3 questions, they could send these out on a regular basis, get some responses, and if they identified any problems, they could parachute a transformation lead in there in order that they could go and have conversations just to make sure they didn't turn into sort of big issues. So again, just making it accessible to people. The stat survey, it is sent out for email, but again, you've got to sit behind your computer to be able to fill it in. And for a lot of the colleagues that we're talking about today, clinical staff or frontline facility staff, they just don't have a computer that they can access day in, day out. So again, putting it onto their personal little supercomputers which are in the pocket just makes perfect sense. Right, just to finish off, obviously our apps are customizable. We've talked about 3 specific ones for staff-related apps, but it's the same system for patients, or improving the patient experience in this concept. So same thoughts. Where people want the information, it's not necessarily in clinic. It's not necessarily, with a consultant when they've, told you about a condition or told you about whatever it might be. So, 9 times out of 10, it's in your own space when you've got time to kind of, compute what's been said. What was that bit of information, and where do I need to go, and who do I speak to? So to put all this information onto an app that the patient can have, but more importantly, they can share the app with their immediate families and carers. It's just again a really great way of engaging with and providing people with the right information at the right time. And I think a lot of patients have welcomed this sort of approach. This one is for a maternity unit. So again, same principle. Top of the screen, your customized logo, bottom tiles or the menu system. Meant to be really easy, so you look at this, it's really intuitive, and kind of where to go. Straight into it. Start of your pregnancy, you've got referral forms again that you need to complete and fill in, and then send back, and again everything can be done via your phone. You could have a look by some YouTube videos at the different birthing units, so you can get familiar with the different areas and different people and different different environments. So all the information that new parents, not just mums, but dads and grandparents and the family members, they can pick up the phone at any time, download the app, and then go and find this information. It's all localized. It's the team at Morecambe Bay that are developing this for their mums or their families. It's not national content. It's not generic. It's all very specific about the process itself, the support services that are available, who to come speak to and contact in an emergency, or any time. And again, we've got this sort of contacts directory. People can just log into the phone, press a button, and they're speaking to that particular unit. Don't have to think about it too much. It's easy. I think in that context, they're more likely to do it. So just a quick about the solution itself. POTA stands for Put It on the App. It really is, an app repository where you can create all of your own content, use videos, put your resources, links to different policies, websites. you've got push notifications, you've got contacts, you've got events calendars that you can use. You've kind of got your forms and surveys, which we've looked at in some instances where you can use them for, staff request forms, handover sheets, patient and families, surveys. It's all within the system itself. We work with you and then license you our product on an annual basis. There's some numbers there at the bottom of the screen, so you can see those yourself, but it's not a very expensive app for what you're getting. So yeah, 2 parts. On the left-hand screen, we've got the content management system, which is what we provide you training on, and you go into the content management system and create the content very, very quickly. I always kind of jest with teams that have used Word or used PowerPoint recently. You're going to be an expert on this. There's nothing really complicated. It's super, super simple stuff, and we provide you with training support all the way through your license period. Just a quick one on the process before we wrap up. Dead easy. Initially, I will have a chat with you. So after this presentation, we'll contact you. But we have a quick chat. Tell us what you want to do or what you're interested in, and we can probably show you examples of other organisations that have kind of been doing it in a similar sort of vein, and talk about how they've approached it. We create a free trial. So if you're genuinely interested, then we can create you a trial, which would be a demo app with some demo content in there, which you can then go and use with your colleagues or with your patients and say, look, we're interested in doing this sort of thing. What do you think? Do you like it? So we can put a trial together relatively quickly for you that you can go and use and show to the different interested parties. So you can have that sort of demonstration, as I say, and show it around. Once we've got sort of an agreement from you and we can kind of continue, then we kind of get the project kicked off. I've put 8 hours in there, which is kind of 8 elapsed hours, and it doesn't need to be much more than that. I know for different organisations there'll be different areas that you need to get involved with, but typically, in terms of our input initially, about 8 hours, and we can get you up and running. I think the fastest one we did was from a chief nurse. At the start of the pandemic, he was responsible for keeping the care homes on the patch up to date. And historically, that would have been a cascading model where they would have spoke to the care home managers, they would have spoke to the staff. So they just wanted to change that at the start of the pandemic. They wanted more control. They wanted to standardise the messages that were going out there. So Yvonne came to me early morning and said, look, this is what we're trying to do. This is what we're wanting to achieve. And by the same day, she was sending emails out to all the care home teams saying, we've got a new app, this is the way we're going to keep you updated, this is how you download it, this is how you use it. So yeah, the system's not meant to be overly complicated. It shouldn't be difficult to be able to procure. It's certainly not difficult to use from an administration point of view, and or from your colleagues, more importantly, that are looking at this and trying to get the information from them. So that's me. If you guys have got any questions, happy to answer those. There's my contact details there. But yeah, thank you all very much for your time this afternoon.
Chris, thank you for the presentation as always. Yeah, I've got a few questions to crack on with before we move on. Gerdy's started things off. Just let everybody know the poll is on your screens before we crack on. Gerdy started things off. How long has this device been used in Dudley, and is this also used as an EPR?
How long has it been using by Dudley? Dudley have been using this now for about 9-10 months. If we're saying EPR being an electronic patient record, no, it's not. We don't tend to store any patient details within the app itself. We are looking as part of our longer term plan in how we can integrate the app better into some of these systems to make it again easier for patients to get their information. But at the moment, we'd make a link to their portal pages. And one that sort of comes to mind that we're using quite a lot is Patient Knows Best. I think a lot of organisations have invested in Patient Knows Best, and whilst it can do some of the stuff that we're doing, our clients seem to think that our app does it better, and then we just link out to Patient Knows Best, and demonstrate people what it does and how to do it and kind of how to log in. So at the moment, there's no direct correlation into any of these electronic patient records.
Yeah, we've had a vouch for that from Samantha McIntosh as well, who's mentioned the app is still in use in Wolverhampton, where she is, and it is fab. There you go.
Thank you. Good,
There you go. Thank you, Sam. Jeanette has asked it. Hi, Chris. The apps rely on Wi-Fi, I assume. If so, how do you overcome rural areas or client locations?
Yes, the app would need Wi-Fi connection. You're going to download it initially, so you're going to need a Wi-Fi connection as you download it. Once you've downloaded the app, you'll get that content onto your phone. It's just then the updates that you'll need. So if people have changed the content around, if they sent a push notification out, and you don't have Wi-Fi connectivity, obviously you're not going to get those updates. How do we improve that? I guess we're waiting for the government to roll out Wi-Fi to all of these different rural areas. It's a difficult one. It's a challenging one. I appreciate that, you know, one size doesn't necessarily fit all, and there are challenges with Wi-Fi. But I think for the majority, you know, that's not an issue, and you know, people can access it. What I would sort of, you know, say is this is not the, you know, the one site. This is not the one solution for a lot of these organisations. This is part of their toolbox. So, you know, they will still cater for older, you know, might be for older folks or people that live in rural areas, you know, where they'll still have to provide some kind of information. But I think for the most part, and the figures indicate we're into the large 90s now, 90 percentiles, that folks have got smartphones these days and are using them. So, you know, it just makes sense to have apps as well.
Definitely. Well, Chris, absolute pleasure as always. Thank you for joining us. We've been asked about the slides, and I've got no doubt we can share them afterwards as well.
You can, yes, and my pleasure, and thank you very much for inviting us along. Thank you, Sean.
As always. Cheers, Chris. Thanks again.
All the best. Take care. Thank you, everyone. Bye.
Big thank you to Chris and the team there for getting involved. So yeah, we're nearly there.